The physician said there wasn't anything we could do.
Something had gone terribly wrong.
Tyler Kahle was only 19 years old when he died of an aortic dissection in 2002. His story was prominently featured in a Pulitzer Prize-winning series of articles published by the Wall Street Journal. This video pays tribute to Tyler for a life lived with passion, a passion laid to rest much too soon. The producers of this video, Methodist Hospital in Omaha, Nebraska, and Tyler's family, wanted to serve as a reminder to all healthcare providers of the importance of family history to the diagnosis of aortic aneurysm or dissection, regardless of the patient's age. Through this understanding, we can honor Tyler's memory and save lives.
Tyler was a really fearless kid.
I mean, growing up, he always had a sparkle in his eye when you'd say, let's do something, and he had that look out of the corner of his eye and that glint.
Tyler and I we were pretty close. We both grew up in Omaha.
Tyler was my best friend. He was there from my first day of life.
Rollerblading was really kind of his passion.
I got it, Joe! I got it!
The more exciting and daring the adventure, the more he was ready to do it.
This would be cool. This would be Marcus and Tyler and I, and it would be Kahle and Sons in the dent repair business. And but you know, that's just the point of life where he was, where it was girlfriends and running around, and had graduated from high school and turned 19, and his whole life is ahead of him.
He was so much fun and had such a great attitude about life.
I remember he always called me Dado, because when he was little, his sister, instead of Tyler, she'd call him Tylo. And so I always called him, hey, Tylo, and then he started calling me Dado. Dado, thanks, Dado. And that was the last time I saw him.
The day he died, I wanted to take Tyler for a ride. And he said to me, he said, Jess, don't always be in such a hurry. There's always tomorrow. And sometimes there's not.
Tyler went to the emergency room on Saturday night, went to see our family physician on Monday, returned to the same emergency room on Thursday, and died the following Monday.
Thoracic aortic aneurysm is a progressive enlargement of the aorta. And so it's a ballooning up or enlargement of the aorta, which is usually the shape of a tube, and once an aneurysm forms, it bulges out in that area. And an aortic dissection is where the blood enters the actual wall of the aorta and then dissects along the wall of the aorta.
Dr. Diana Milowitz is Director of Medical Genetics for the University of Texas Medical School at Houston and holder of the President George H.W. Bush Chair in Cardiovascular Medicine. She is also the lead investigator and director of the new Specialized Center for Clinically Oriented Research in Thoracic Aortic Aneurysms and Dissections.
It strikes suddenly, and unfortunately, when it strikes, it's often deadly. We know that acute aortic dissections are the 13th leading cause of death in individuals, I think 50 to 65 years of age, and the 15th leading cause of death in the U.S.
I wonder how many people have had this, that it gets marked down or goes down as a heart attack. And then we find the case of John Ritter.
In 2003, the death of actor John Ritter brought national attention to aortic aneurysm and dissection. Ritter, the Emmy Award-winning star of the 1970s and 80s sitcom Three's Company, collapsed on the set of his latest show. He was rushed to the hospital where he died of an aortic dissection at the age of 54.
Don't miss the diagnosis, because it is deadly if you miss the diagnosis.
Jessica, my daughter, called and said Tyler was going to the hospital and that he's having chest pains.
At the time when we went to the emergency room, I think because we had mentioned that he had allergies, that probably played a role in the diagnosis that they made. They did do a chest x-ray that didn't show anything. And the EKG, at the time they told me was normal.
A thoracic aortic aneurysm will not be detected by a chest x-ray or an EKG of the heart. You have to go in and image the aorta.
They told him to go home and rest and see his family doctor the following week.
From my research, I know that physicians do not understand that there is a genetic basis to this disease.
Tyler was not the first member of the Kahle family to seek medical attention for unexplained chest pain. Tyler's father, Terry, had an aortic dissection and successful surgical repair in 1998 at age 42. Tom Kahle, Terry's brother, was just 38 when he died of an aortic dissection in 2001.
The doctor was informed again about the family history we'd had of aortic aneurysms.
They had called one time while they were in the doctor's office. I said, put the doctor on. And I said, I had an aortic dissection. Is it possible that that's what Tyler's having? And the doctor said, this is respiratory.
And our physician thought that he was too young for this to be even considered.
Physicians need to be aware that aortic dissections can occur in teenagers and even in young children.
And he made the same diagnosis that the emergency room made, that he thought it was allergy related, it was pleurisy.
We know from the families we follow with a genetic predisposition that it's not uncommon that they are misdiagnosed and mismanaged with this disease.
Dr. Milowitz's work into the genetic basis of thoracic aneurysms and dissections has helped establish that about 20% of these cases are genetic, and the earlier in life aneurysms occur, the more likely it is to be genetically based. Dr. Milowitz's team has performed DNA studies of more than 3,500 individuals from over 400 extended families affected by this condition, including the Kahle family.
On Thursday of that same week, his chest pain had come back and was pretty intense. So I drove to the emergency room, and again I told the staff that we're wondering, maybe we should be thinking about his aorta. So I asked, can we have a CT scan? And she said, this is not his heart. I know this is pleurisy.
I mean, it's a 15-minute test. It's non-invasive. If they had done that, they go, hey, here's the problem.
Dad says you need to have these tests done, and Tyler said to me, he said, Jessica, they're doctors. They know what they're doing. Now
I'd had 3 medical experts tell me that this was respiratory, not cardiac.
If you misdiagnose it and send somebody home, they're virtually guaranteed to die.
The phone rang, and it was Tyler's roommate, and he told me that Tyler was having chest pains again, and he was going to the hospital.
And walked back out to the desk, and I said, where is my brother?
The physician said there wasn't anything we could do.
Something had gone terribly wrong.
And this time, it was fatal.
It was his heart.
And I knew right then that he'd had an aortic dissection. I just knew that's what it was. My family physician called, and he said, boy, I'll really be surprised if it was an aortic dissection.
I lost my son, and I told you what it was. I told you what to look for.
it was an aortic dissection.
I don't think the genetic inheritance of aortic dissections was recognized by the emergency room physicians, and they didn't listen to Tyler's history, his family history story.
The issues are all around recognition of the...
Dr. William Schiffermiller is Methodist Hospital's Vice President of Medical Affairs.
Knowing the family history, getting the family history, recognizing the significance of the family history, and taking the family history to heart. Those are the mistakes that were made.
The other mistake we made was to assume that because he was young, this particular process was unlikely to occur. Frankly, I think we, like most hospitals, were ignorant of the fact that this can occur in very young people, and we should actively pursue it in that age group.
In his new role as Vice President of Quality Improvement for Methodist Health System, Dr. Antone Piscotch worked to identify and correct any weaknesses in the system.
Yeah, this is for the Nebraska. We had multiple opportunities to do the right thing and repeatedly neglected to do so.
Dr. Joseph McCaslin was appointed Medical Director of the Methodist Hospital Emergency Department after Tyler's death. He has worked closely with Dr. Schiffermiller and Piscotch to implement changes within the emergency department to prevent a tragedy like this from happening again.
As the clinician, of course, you think about, okay, what could we have done differently? What happened here? Why did we not pick this up?
Well, after the incident with Tyler, we decided to look at our process of care and to see what we could do with our system to try to lead practitioners to the correct diagnosis in this setting.
Methodist has put on their intake form in the emergency room, has prominently put the aortic dissections in multiple places so that the physician does think about that. It's also part of their family history intake. You know, does this patient have a history of family history of aortic dissections? And I think that is a great first step to making sure the ER physicians are always thinking about this in the differential diagnosis.
The process that you want to have in place is that person who comes in with chest pain gets asked the question about family history of dissection or aneurysm, and that family history, if it's positive, is recognized as a significant issue and acted upon.
Has anybody in your family ever had any trouble with their aorta, with an aortic aneurysm or aortic dissection, do you know?
And now force certain types of imaging studies to be done if we cannot exclude that as a cause of the pain.
It has more to do with making sure that you make a process that doesn't allow this to be missed.
And through that process and into development, we have, over the period of about 18 months, 2 years, developed a chest pain center or clinical decision unit where we now, instead of sending a lot of those patients home and just saying, go see your doctor tomorrow or give them a call, we actually keep them around, do further evaluation, and try to pick up more of these diseases.
The Methodist Hospital Chest Pain Center is a 24-hour-a-day, 7-day-a-week clinical decision unit within the emergency department. Experienced cardiac care clinicians assess patients with acute coronary symptoms to prevent inadvertent discharge and minimize unnecessary admissions. Chest pain assessments may include lab work, stress testing, and state-of-the-art diagnostic imaging. The Chest Pain Center provides rapid transfer within the hospital for appropriate testing and treatment as needed.
Since Tyler's death, I know of 5 cases of aortic dissection which were successfully diagnosed in our emergency room and taken to surgery, including one of my own patients.
Education of practicing physicians outside of the emergency room is also important.
If they see an individual in their clinic that has a family history of aortic aneurysms and dissection, that individual needs to be assessed for an genetic predisposition to the disease. and has to have aortic imaging. In addition, I would recommend that that individual be seen by a geneticist to determine who else in the family is at risk for this disease. Because once again, once we know this disease runs in families, it's not just the patient the physician who is seeing that's at risk for the disease, but there's maybe many other family members who are at risk. And certainly if the patient has features of Marfan syndrome of Loeys-Dietz, that they need to think about imaging that individual with or without a family history.
Also spreading the information around to other facilities in the area and the region. Make sure that everyone is aware of it, even though they haven't experienced the tragedy that we did.
It's a terrible tragedy and a loss for the family. We're all family members. We have children, we have brothers and sisters and parents, and when things happen, of course, the first thing you think about is how would that, the terrible loss that family's experiencing.
Still reeling from the unimaginable loss of Tyler, the family faced a chillingly familiar health crisis just days after his funeral. Upon returning to his home in Atlanta, Marcus, Tyler's older brother, began to experience chest pains.
His dad took him to the hospital there where he had his surgery and ran into similar circumstances there because he asked for a CT scan and they didn't want to do it.
I said, I think I'm getting an aortic dissection, and she said, no, you're too young for that. I said, listen, my brother just died, my uncle's died, my cousins have died, my dad's had it.
And Terry pretty much demanded that they do it.
I buried my brother a year ago from the same thing, and I just buried my 19-year-old son, and that we were going to run that test.
Then they did the CT scan, and they could that gave a more in-depth view of the aorta, and they could see there was a ballooning effect on it.
Because of Tyler, we were aware of it, and that may have saved Marcus.
If we can learn anything from Tyler's death, it is that family history cannot be discounted.
The advice I would give is don't leave the emergency room until the imaging is done and the physicians can assure you that there is not an acute aortic dissection.
Significant progress made by Dr. Milowitz and her team into the genetic mapping of aortic disease and identification of biomarkers has raised hopes that a simple blood test to speed diagnosis of aortic dissection may become available in the near future.
We can do all the research we want to do and come up with new therapies and new imaging, but unless physicians stay on top of the progress of the research, that doesn't get translated into the clinical care of these patients. So part of our center is not only to do the research and come up with better ways to diagnose it, follow the disease and treat it, but also to get out and educate physicians on the management of this disease.
We hope never to miss this particular process in a young person again. And hopefully the new protocols will allow us not only to prevent it from happening here, but help other people prevent it from happening at their institutions also.
You know, of course, losing a child to this and very nearly losing another child to this, we want to see an end to it. We want to see the research completed, and we want to have, as many lives saved as a result of this.
This program is dedicated to the memory of Tyler Kahle, with the hope that his story will raise awareness of aortic disease and, in turn, save lives.